Pennsylvania state lawmaker wants to allow needle and syringe exchange programs to operate here in Pennsylvania.
Currently, those programs are prohibited since they break drug paraphernalia laws. Fox 43's Chelsea Kerbler joins us now in Harrisburg to explain how the program would work.
Critics of needle exchange programs believe they just lead to drug users using more. However, advocates say these programs are crucial to public safety. Staffers at Retreat Behavioral Health in Lancaster County see firsthand the toll drugs can take on the body. They also see how the lack of access to clean needles can have lifelong impacts on someone's health.
Especially with intravenous drug users, HIV and hepatitis C is very prominent.
With legal exceptions in Philadelphia and Pittsburgh, needle and syringe exchange programs in the rest of the state are illegal under current drug paraphernalia laws. State Senator Anthony Williams of Delaware and Philadelphia counties plans to introduce legislation to make it legal for these exchange programs to operate across the state.
These would be local decisions made by, the local government as to whether they want to have a program within their communities or not.
A recent study published in the Journal of Acquired Immune Deficiency Syndrome estimates Philadelphia's syringe exchange program, which began in 1992, has prevented more than 10,000 HIV diagnoses in its first 10 years. While some opponents believe these exchange programs only encourage drug use, Peter Schorr, CEO of Retreat Behavioral Health, says it's about public safety.
The only thing it does is encourage people not to use and spread disease around to other people.
Schorr hopes if this type of legislation were to pass, it would provide users using the needle exchange programs information on how to get treatment. In Harrisburg, Chelsea Kerbler, Fox 43 News.
Needle exchange programs have a long history on the federal level. In 2009, the U.S. House voted to remove the ban on providing federal funding for syringe exchange programs. That overturned a 1988 federal rule that prohibited states from using their share of HIV/AIDS prevention money towards syringe exchange programs. That bill included a restriction against using the money to assist any program that distributes needles within 1,000 feet of a school, park, playground, pool, or youth center. And according to the ACLU, this was an important step in the right direction. It says injection drug use and infectious disease make needle exchange programs an imperative public safety need. The ACLU cites that there are an estimated 350,000 regular injection drug users in America, and also believes that all of them are at an increased risk of contracting and spreading fatal blood-borne diseases. More than a quarter of AIDS cases among people aged 13 and older are directly linked to injection drug use, according to that union. Injection drug users are also at a serious risk of contracting hepatitis B and hepatitis C.